My name is Harry Crawford III, MD. I do work assisting with Valley Family and Elder Care here at Bridgewater Nursing Home Community, Retirement Community, and I am interested in medicine. I am interested also in the COVID-19 vaccine because that is going to be our route to vanquishing the problems associated with this virus. I know everyone seems to think that the vaccine was sped up and created so quickly this year. However, the technology and the information regarding producing this vaccine actually has a history of approximately 15 years. Back when SARS-1 was prevalent, things were done to look for a vaccine capability that would allow us to put together a vaccine that was amenable to whatever came down the pike. There are different types of vaccines. There are vaccines that are made from viruses. There are vaccines that are made from pieces of viruses. But they were looking for something that they could modify fairly quickly associated with whatever vaccine that may be prevalent at the time, whatever virus, may be prevalent at the time. So over time, they knew that messenger RNA was a means of producing various enzymes and various proteins in the cell. Utilizing this information, they found that if they could template the messenger RNA so that it could produce a priron, which is another name for a piece of a virus, that the body could respond to, this is something they could use for a variety of different types of vaccines. The unique thing about the vaccine that we're dealing with now, produced by Pfizer and Moderna, is that there is no virus particle in the vaccine itself. What is there is a template for a particular particle of the virus that is infective. So what the vaccine does, it teaches your body to recognize a particular particle in the virus that causes infection. There is no virus, I can repeat this, there is no virus in the vaccine itself. So you cannot get COVID-19 from the vaccine. That's a very unique attribute to this particular vaccine modality. Now, 3 companies, Pfizer, Moderna, and even Johnson & Johnson, are producing this type of vaccine. Pfizer and Moderna have been produced and are in distribution now. Johnson & Johnson's will be out probably sometime late February to March timeframe. So the vaccine we have now, Pfizer and Moderna, teaches the body to recognize the protein spike on the virus so that it can kill the virus and render it ineffective. The second shot, which is necessary, actually primes the body. It's kind of a test to tell the body, okay, this is what we asked you to do before. Let's see how well you can produce the immunological cells and immunological particles to fight the virus. So the first shot provides about 50% protection against the virus. The second shot cranks that up to about 90 to 95%. If you're going to have any problems with the shots, usually it's going to occur on the second shot because the body has already learned how to fight the virus. And the second shot kind of primes it and gives you an idea about what the body's response actually can be. Well, studies have not been done on pregnant women in this regard. The virus has not been around long enough to have a good idea about whether or not it causes problems with sterility or infertility. The preliminary information is that it does not. And part of that has to do with the uniqueness of the vaccine. There are no viral particles in this vaccine. It is composed of what's called messenger RNA, which the body already utilizes in production of enzymes and proteins. So Moderna has done some work on pregnant rats, so to speak, and the information they have produced indicates that there is no issue directly associated with fertility or pregnancy with the vaccine. Now, it has not been done in humans, and both Moderna and Pfizer have human trials in process. Balancing the risk of getting the vaccine versus not getting the vaccine, and the prospect or the thought about getting pregnant. I presume I'm saying that correctly. It depends on how much you expect to be exposed to the COVID-19 virus. However, you have to consider the fact if you were to get the COVID-19 infection, there are certain things that you have to worry about. The possibility of, having to go to the hospital, the possibility of being in the ICU, the possibility of long-term ramifications secondary to the virus itself, and even the possibility of dying. That has to play an important part in your decision. Studies actually have not, like I said, directly been done on pregnant women, and there are pregnant women who have gotten the vaccine who are in studies now. However, you have to also consider that if you are pregnant and you get the COVID-19, there are ramifications for your fetus. All kinds of ramifications as far as incomplete oxygenation is concerned, birth defects, and we don't know all of the possibilities there, but they do exist. So weighing the problems that you would have yourself and the problems your fetus would have if you got the virus, you need to talk to your own provider, but it would make sense and it would be something to strongly consider, getting the vaccine to prevent having to deal with the ramifications secondary to having the COVID-19 infection. Well, the post-vaccine side effects usually are consistent with what one would get or have with a regular flu shot. You may have some soreness in the arm. People who have reactions generally to vaccines, as long as it's not anaphylactic, can expect that they'll have fairly minimalized reactions to the vaccine as it's produced or given now. The second shot is where you would have any issues with discomfort more so than the first shot, because the body's already been trained to respond to this particular type of virion. I have advised my patients, if they're going to take the shot, get the vaccine, take a little Tylenol ahead of time if you feel that you're going to have some issues with this. Occasionally you can have just a general malaise associated with the vaccine, but it, like I said, does not have any viral particle in the vaccine itself. So generally the reactions for the most part are less than you might expect when you're dealing with a viral mediated vaccine. Yes, they should. I've kind of looked at this in depth. The problem, if someone has already gotten the virus, is we do not know what level of immunity is conferred on a person once they've had the virus. And not everybody is going to have well, let me back up a little bit. Not everybody is going to have the same response as far as their immunity is concerned to the infection. Some people may develop immunity for about 2 or 3 months. Some people may develop immunity for about a year or so. But the general consensus now is even if you have had the infection, it is prudent to get the vaccine. It is a known quantity, and it will just provide extra and added benefit and protection. I will be getting the vaccine myself. I have no qualms about getting it. And I look forward to having some protection given the fact that I am a physician and I do see COVID-19 patients. I think my general recommendation would be to consult with your primary care physician or primary care provider in this regard with an eye towards getting the vaccine if you have any questions about whether or not you should be getting the vaccine. There will be other vaccines coming out later on. Johnson & Johnson has got a one-shot vaccine coming out. However, that vaccine is a virus-mediated vaccine where they have replaced part of the virus that they're using in the vaccine with the information about COVID-19. It's an adenovirus, and generally people, for the most part, do not have a problem with this particular virus and vaccine. Johnson & Johnson is coming out with a vaccine similar to the Pfizer and Moderna vaccine, but they're not playing that one up as much. GlaxoSmithKline will have a vaccine out next year. Unfortunately, they had to be delayed, but theirs was a virus-mediated vaccine. So for right now, if you can get the vaccine, if you feel that there shouldn't, if you feel that you could possibly cause problems with others and yourself if you got the virus, I would think that applies to most people. I would get the vaccine and get the second shot. It's not a bad idea to take Tylenol ahead of the vaccine to help deal with whatever side effects you may have just secondary to the physical shot.